It's time to put your health in your own hands. Get ready to learn from today's top health and wellness innovators and thought leaders on Optimal Health Radio. Now, here's your host.
Hi, everyone. This is Dr. Tami Patzer, and today I am really excited to talk with our guest, Dr. Cameron Clark, and he's from Hoffman Estates, Illinois, where he is a Relief Now laser method practitioner. Let me tell you a little bit about Dr. Clark. Dr. Clark grew up in nearby Crystal Lake, Illinois, where his interest in sports medicine and orthopedics started. Growing up, he was active in multiple sports: baseball, football, golf, track. And throughout high school, his passion for personal fitness began to grow as he started to train for different sports. His undergraduate, excuse me? Oh, I'm sorry. I thought you...
Yeah.
So,
Nope.
Sorry about that.
It's okay.
Normally, it's real smooth. So, hello, everyone. This is Dr. Tami Patzer, and this is Relief Now Laser Methods Optimal Health. Today, we're speaking with Dr. Cameron Clark, and he has a practice in Hoffman Estates, Illinois. He grew up in nearby Crystal Lake, Illinois, where his interest in sports medicine and orthopedics started. When he was growing up, he was active in multiple sports: baseball, football, golf, and track. And over the years, his passion grew for personal fitness as he began to train for all of these different sports. His undergrad studies led him to study sports medicine at Carroll College. While there, he traveled with various sports teams, and he ended up working for the Milwaukee Wave, a professional indoor soccer team. And he noticed that different players were going off to see chiropractors, and that they would come back and say they really felt good and that it was helping them a lot. So he said that he was surprised when the chiropractor also worked in conjunction with an orthopedic surgeon, and that the chiropractor actually had a physical therapist in his office. And he says, wow, that was an eye-opening experience. So with that, as he continued his education, he went, and he didn't want to go to medical school or prescribe pharmaceuticals. He decided that chiropractic would be a good fit. So after he graduated from the National University of Health Sciences, he became certified in acupuncture and kinesio taping, which is very popular with athletes. And he also became an athletic trainer. So fast forward to today. Recently, Dr. Clark added Relief Now laser methods to his practice, and that's what we're going to be focusing on today. So with that, welcome, Dr. Clark.
Thank you, Tami. Nice to be here.
So tell me a little bit more about your background and why you think the laser methods is the way for your patients to get some relief without drugs or surgery.
Yeah, so I mean, my methodology has always been to try to not to provide care for people that doesn't just cover up their pain or maybe briefly interrupt their inflammation. We've always tried to provide services that fix the root of the problem, create actual tissue healing, create proper joint motion. How are we going to fix this problem so that it doesn't come back? Okay. So I've always been a big proponent, obviously, of chiropractic care, doing rehab to strengthen muscles and improve joint function. And class 4 laser therapy is just the next logical option as a modality to provide these people, because it's actually stimulating true energetic tissue healing. So being able to heal the tissue from within and not just cover up symptoms, knowing that, hey, you don't need a drug to make yourself feel better. That's what the appeal was for me for laser therapy.
So with laser therapy, what are your specializations? I guess not only in the laser part of your business, but overall.
Specializations are mainly I've gotten extracurricular hours in functional rehab. I've done a lot of post-grad in functional rehab. I've gotten my acupuncture certification, and kinesio taping is another certification that I've gotten as well, which is it's a great rehabilitative tool. It actually works well in conjunction with laser therapy to support muscles, tendons, and joints around the affected area.
So with the new laser systems, the Relief Now laser methods, what are some specific areas that you're going to be focused on with this Class 4 laser?
So really, lasers cleared to treat over 3,500 conditions. Okay, but in our office, we tend to see, what comes in the door the most often. Well, other than back and neck pain, which it works great for, and even, if there's a pinched nerve going on in the neck or back, also works great for. Knee pain, shoulder pain, plantar fasciitis, tennis elbow, carpal tunnel syndrome, wrist pain, TMJ, it works excellent for, and even peripheral neuropathy gives excellent results with laser therapy. So there's a variety of conditions that we can treat with it, but the ones that that we just talked about there, that's definitely what we see the most common.
So basically, it seems to work for your full body. So how does laser therapy work?
So laser therapy works through a process called photobiomodulation or photostimulation, which, to break it down, I guess, into layman's terms, is the light enters the cell and it goes through this receptor on a cell called a chromophore. And I tell my patients to think of those chromophores like solar panels on the top of a house, right? Those solar panels are going to absorb that energy and convert it into energy for, say, the house. In this case, the chromophore is going to convert that laser energy into energy for these cells, okay? And when we treat an area, so let's say we're treating a shoulder. There's numerous cells in there that are damaged from tendonitis or bursitis or maybe a partial tear. Those cells are going to soak up that energy, and then they're going to be charged up. They're going to improve their metabolism for the next 18 to 24 hours. Over that time, you keep charging those cells up, and then they improve their healing, they improve their metabolism. That leads to tissue repair, that leads to increased blood vessel growth, that leads to increased lymphatic drainage. So it's really like giving the damaged part of your body almost like a charge so that it can fix itself.
So with that, you said that over the treatment works in your body over 18 to 24 hours?
After each treatment, it does. So, but over time, the treatments are cumulative, right? So in general, we see people between 6 and 18 visits. It depends on condition, right? But as those visits go along, the tissues start to heal for longer and longer periods of time, leading to just resolution.
So when you say resolution, that means it actually ends up healing over
Correct.
that time. Why does it work, or how does it work without drugs or surgery? I mean, a lot of people, the first thing they think of is when they're in pain, what do? They take a Tylenol or ibuprofen or something. So would you still need any pain medication with this system?
Well, obviously there's a time and a place for those. I'm never one to tell someone like, oh, you should never take an Advil or a Tylenol ever again, right? That would be hypocritical of even myself. But when we're talking about chronic inflammation or, some of these conditions have been going on for years in people, you have to ask the question, you've been taking let's say Advil daily for 3 months, your condition isn't improving, right? It's you still got into my office. Well, when we take these anti-inflammatories, they block inflammation, but they also block the later phases of inflammation, which can lead to resolution and healing and tissue repair. Okay, so when we introduce something like laser, we're trying to tell the people at that point, you don't need to take those drugs anymore because we want to push the body so that it can actually repair itself and not continually keep blocking the process that it kind of needs to complete.
So when you're doing the laser therapy, how is there any research that backs up all of this information that you're giving us?
Yeah, class 4 laser therapy has, close to 1,000 medical studies published, and it's got FDA approvals for, I think, over 25 conditions at this point. So there is plenty of research out there that supports what we do.
So with that, are there any side effects that people would need to be concerned with, or any type of person who should not be using class 4 laser therapy?
Yeah, there's really only two contraindications that we do with class 4 laser. If a woman is pregnant, we're not going to laser anyone who's pregnant. If there is a known active site of cancer, we're not going to laser over the site of cancer because of how it increases cell metabolism. At this time, we stay away from it. Now, there's a lot of newer research that is showing that you can almost possibly treat cancer with it, but there's not enough there to say anything yet. Those are really only the two contraindications. Class 4 laser therapy, there's almost no side effects. When you get treated, it does not hurt at all. It feels honestly kind of soothing. It's like a warm, soothing light. Occasionally, maybe I would say a small percentage of people are sometimes have some soreness the next day after their first treatment or two. And that's usually just a case of cellular byproducts, metabolic waste being released from the area. I tell people it's kind of like when you get sore muscles after working out. It's just we're introducing a lot of new tissue activity to that region that it's not used to.
So with that, so basically very minimal side effects, if any. Mm-hmm. Are there other modalities that are complementary with laser therapies?
Yeah, the big one that we use a lot in our office is spinal decompression. If someone comes in that has degenerative, bulging, or herniated discs that are compressing a nerve root in the spine, laser therapy plus disc decompression works tremendously. I almost advise anyone I know, family members included, that if you don't want to get epidural injections or think about spinal surgery, laser disc decompression is such a good alternative for people. We also, with knee pain clients, we have knee decompression therapy in the office, which works fantastic at opening up the knee joint to stretch out the ligaments to get synovial fluid into the joint. Allows the laser to penetrate deeper into the tissues and help, honestly, provide a little true joint decompression on possibly a knee that is already too compressed. Chiropractic adjustments work great with laser therapy. Any sort of joint mobilization or soft tissue mobilization post-treatment works fantastic. And then for certain conditions, I like to follow up with kinesio taping as well, because it stimulates prolonged blood flow to the tendons we have just treated, and can give some comfort in between treatments for patients as well.
Wow, there's quite a bit that can be done. So if somebody wants to reach out to you, what's the best way to do that?
Yeah, so our phone number, 847-839-8888, for those of us who still pick up the phone and call. Otherwise, our website is reliefnowlaserhoffmanestates.com. You can go to that website and you can just click on, the consultation button, put in your name, email, address, and we reach out to you and we can get you in. Usually you can see what laser is all about, and we can look at your affected body part and see what it would take to get you better.
So do you have any special offers for people to come in and try it out?
Yeah, on our the Relief Now site, if you're a new patient to the clinic, there's an $80 special for your first consultation, and so that includes consultation with me and first treatment. From
Okay.
there, we go through what does this look like it's going to need, and you get an idea of what our plan of care would be.
So with the lasers, I'm really curious because it sounds so new, but how long has class 4 laser therapy really been around?
Yeah, I would say class 4 lasers seem to come onto the market, I would say about maybe as early as 15 years ago. If we would go back maybe like 08, 09, we started seeing some of the first class 4 therapeutic lasers. Probably heard the term cold lasers in the past, and those are class 1, 2, and 3 lasers. They've been around since maybe about 2000, maybe even late 90s. But as the technology has advanced, the research started to show that class was really where the more sustainable and predictable results were starting to occur. And then just as more research comes out, the devices themselves keep getting better and better and better, and we're able to treat more and more conditions.
It sounds like it. So like you said, it's all FDA approved, and
Mm-hmm.
so people can feel confident that the tools you're using are, safe and effective and everything. And then, of course, you have that expertise. Before I let you go, is there anything that you'd like to add about you, your practice, anything?
Yeah, I mean, anyone in my area, which is Hoffman Estates or Schaumburg, I've been in practice there for 15 years now. So my clinic itself is one of the longest, running chiropractic clinics in the Hoffman Estates Schaumburg area. We're actually affiliated with a nearby hospital. So we've got a lot of history there. And I think people that have come to my clinic know that I'm always trying to stay ahead of the curve in what we offer patients, right? There's always got to be something that I feel separates me from, what's the other chiropractor you see doing, right? We want to position ourselves as a true orthopedic clinic that can take care of any joint in your body without the need for prescription medications, injections, or surgery, right? And there is so much that you can take care of now with the tools that we have, where there's a lot to do before we even have to think about going to the next level like that.
Okay. So everybody, if you want to give Dr. Clark a call, it is 847-839-8888. That should be an easy number. And can you repeat your website again, please?
Yeah, it's www.reliefnowlaserhoffmanestates.com.
Okay, thank you. And everyone remember Relief Now Laser Methods. It's ditch the drugs, skip the scalpel. So thank you so much, Dr. Clark. I really appreciate your time today.
Yeah, thank you for having me on.
Thank you, everyone.
You've been listening to today's top health and wellness innovators and thought leaders on Optimal Health Radio. To get more solid health and wellness information, visit optimalhealthradio.com.